foam rolling and mobility sequence. Microphone didn't work as well as I wanted it to, so I'm going to kind of talk you guys through this. First things first, we're going to go on to our glutes. There's multiple ways you can do it, with the leg down or the leg crossed over. The video is going to kind of look like an old kung fu movie with my mouth moving and me talking over it, so just kind of sorry about that. I'm working on the headset to try to make it a little bit easier for you guys to hear me on the videos. Everything we have here in transition is 30 seconds per side, per body part, or per area that we're working on. So transition, when you see me transition, kind of follow along. The legs crossed over right now, keeping that toe nice and flexed. Working on finding those tight areas, or those areas a little more sensitive. Tilt to your side. Remember, when you're doing the glute, when you're doing that external rotation on the hip, whatever leg is crossed over is the side I want to lean to. All right, so we're crossing over, change over to your next side. Really take your time on this. If you need to use your hands to brace, you can put both of them back, have one, and just hold on to the one side. It's really up to you on what you feel more comfortable with. Tilting to the outside and getting more and more lateral into that hip is going to be a little more tender for most of you. Take your time here. If you need to at any point in time, pause the video because you want to spend more time on a certain area or a certain side or a certain body part. Feel free to pause it. As we transition now, we're going into our thoracic spine, our mid, upper, and low back. Giving myself a hug here to open up those shoulder blades. With the regular foam roller, you want to tilt slightly to one side so you're not directly on the spine. You want to kind of be on that muscle and that QL and everything just lateral of your spinal cord. You can give yourself a hug or support your head, and if you need more neck support. Between the shoulder blades, you're going to find some areas, if you tilt from one side or the other, almost down to that lower lumbothoracic area. So as you get lower and lower, make sure you're conscious of keeping your rib cage tucked. Grabbing the back of my legs on this. Staying upright, trying to keep that crunch position, making sure I don't jeopardize my lower back. You start to lean back when you're doing this, the rib cage comes out, you're going to jeopardize your lumbar spine and your hip positioning, and you really don't want to lean back like I'm showing right now. So try to stay crunched up as much as possible, keep that rib cage down, and work on finding those areas that are tight. 30 seconds or more. As we're transitioning, everything again is 30 seconds at a time. So we're changing over now. We're going to be going into our quad work. When you're doing one side, keep that leg as relaxed as possible. So you can see I'm not grabbing the ground with the leg that I'm rolling or flexing through it. Try to stay relaxed and try to allow that foam roller to get as deep as possible. If you want to actively release and pull that heel to your butt, you find a tender area. Feel free to slow it down, target those spots, windshield wipe, pull it, control your movement, slow things down. For most of you, the left side is going to be tighter than the right. We transition now to the IT band, get to the outside of that thigh. This is going to be one of the more painful or tender areas for most of you. Active release if needed, or you can stack your feet if you want to put more pressure on it. The main thing is trying to keep that bottom leg as relaxed as possible. I say relaxed, even though you're probably in pain on this one. This is one of those areas that we really need to pay attention to, are the quads and the IT band that get really dense, get really tight, especially when we're in the seated position at the home office, whatever we may be doing. Running outside, these are the areas that need a lot of attention. So if you had some hip issues, some lower back, some knee problems, this is going to be the one spot I'm going to tell you, the more it hurts, the more you need it. Take your time rolling through it. I can windshield wipe in and out. I can pull my heel towards my glute to actually release those tight spots. Take your time with it. This is one of the ones where I would suggest that you pause the video, spend as much time as needed or as you can take on this right now. As I go into my IT band, I'm working on bringing the top leg in front when I cross it over, so I can use that top leg to actually help actively release some of those tight areas, some of those denser areas along the IT band. You're going to find that the left side for most of you will be tighter than the right. If it's just the opposite, it's fine. Just take more time on the tighter side. Now that we're done with the outer quad, we're going to work on the inner. We're going to work on the adductors into some of the groin. Take your time on this one. My knee and my hip are bent at 90 degrees, and the foam roller is parallel to my torso. So you want it upright. You want to go side to side on this. The knee that's bent, try to stay relaxed and let that foot almost drag the ground. My other leg that is down on my arms are my anchor to move me side to side. You take your time on this. Concentrate on hitting some of those target areas. Pause on it. Move along it. Actively release. As you see, when I get to the other side, I add some movement by straightening my leg and then bending it. It's not necessary. Get almost into where it connects into your hip tissue. Work on your breath. Take your time on this. If you're doing this in the morning time, this is a great time to really think about linking your breath up and your mind up to your body. Moving through windshield wiper movement, internal, external rotation while I'm on the adductor. Modify this, remove the roller as needed to try to find those target areas. Now that we're done with the foam roller, we're going to work into some mobility work. Loosen up some of the joints, loosen up everything we're doing. Starting off with our heel sits, everyone's favorite. Make sure those toes are tucked under. You want to be in a flex position, so we're trying to stretch out those toes and the arch of the foot. I'm going for a total of 30 seconds here. For somebody that needs a little bit more relief, you can't do this the same exact way where you can just sit back and hold that position. You can actually shift forward like you can see me doing right now, take a little pressure off, and I just keep my weight forward, not so much back over top of my heels. Otherwise, you're going to sit on top of your hips, come over top and get that stretch in. 90-90 positioning is next. When we get into this, we really want to look at our body position and make sure that our front leg, that shin and knee are down on the ground. If we don't have that positioning, as you see me lining up my shin, make sure you put something, a pillow or a block underneath of it to make sure that you don't have that pressure on the outside of the knee and we're doing the stretch properly. I want to look at my body position. If you have a mirror in front of you, you can try to get as upright as possible or see where you are. If I'm having tension in that back leg, so for me right now, it's my right leg, I have tension across in my hip joint and that capsule. Perfectly normal, happens to a lot of us. We spend a lot of time in the seated position. Take some time and just work on that positioning and stay nice and tall and allow that to stretch out. When I fold forward on this, I'm going to keep my chest up, trying to keep my body position. You can see my back is staying as straight as possible. I'm not diving down and putting my chin to my knee. I want to stay nice and tall. We're going to do 3 to 5 reps on each side. Again, take your time with this. Every time I go into the stretch, the tighter portions, I lean forward, I'm exhaling, working on my breath. If you know how to open up and how to do the forward movement and then open up like you see me in the video doing, you can do the forward fold and then do the back rotation and work on rotating back. Otherwise, just work on the forward fold if you've never done it before. All right, transitioning over to the other side, same thing. Work on the body position. You're going to get a front view on this one. This is the tighter side for me. Whatever leg is forward, using that arm, that same arm, to try to keep yourself as tall as possible. Forward fold, chest up. So nice and tall. If I can open up, I will, but not if my front knee is coming off the ground. As you can see me demonstrating, the front knee was coming off. So when I open up, I can take my hands away. Harder version, more advanced version. Otherwise, keep your hands down. Forward fold. And open up and look back towards that back foot. Arms can be locked out if you want to try to fold here and then open up. This is a much harder version. Now transitioning over, we're going to do some kneeling long lunge. So this is more about body position again, trying to open up those hips, get ready for the day. We're winding down from the day. As I step forward, kneeling position, I'm going to place my hands on my ribs to try to keep my rib position down the entire time. We want to make sure that our back foot is flexed, and then we're going to drop it down. Relax it, put tension in the front of that hip. You can see where I want you to feel the stretch right here. Rib cage is tucked. Drive that hip forward by either squeezing the back leg glute or driving the knees. We're going to go into a long lunge now. Now it can be a kneeling position, level 1. If you want level 2, we're going to go into the straight leg position. Trying to keep the back leg straight. My hands are just inside my front ankle, my front foot. Work on that hip stretch, breathe through it. We're doing an actual static hold here. This is not dynamic. Changes to the other side, same thing. Rib cage is going to be down. This is to make sure that I'm not compensating in my lower back. If I take it away, my hands away, and I kind of roll through by trying to lean as far as I can and lean back, all you're doing is jeopardizing your lower back and not getting the proper positioning. So ribs are down, drive the hips forward, and only take what it gives you. Lower back's healthy, stretches in the front of the hip. Advanced movement, again on this side, we're showing hands inside the ankle, kneeling position. If you want to go up to the higher, more advanced one, straighten that leg out. We're on long lunge, we're holding here for 10 seconds or more. Great job. Now, going into our next movement, we're going to do our windmill. Now, when we do our windmill positioning, normally you would have a pillow under the head and the roller or a few pillows underneath the knee. Bottom leg straight, top knee is going to bend up. We want to make sure that hip positioning is bent at 90 degrees or closer. What I mean by that is your top knee needs to be closer to your chest than it is to your bottom leg. So bring that knee up towards your chest, close off that lumbar spine, lock yourself in position so that we don't have any movement in the lumbar area. I'm working on keeping my leg in position and keeping it locked in. For right now, my hand is supporting my head. Good exhale, look for that hand, and I'm opening up. Now, I've done this one before. If you have a hard time with this, only go as far as your body allows you to. Your eyes need to follow that top hand the entire time. So don't think that you need to tense up. If you find yourself not breathing, breathe. Slow it down. Exhale as we open up. You can also take your bottom arm to actually hold that knee in position so you don't feel like it's moving and so it doesn't slide down on you. This isn't a drill that you want to compensate and try to see how far you can get. You're only taking what it's giving you. Slow it down and breathe. If you have any comments or questions on the videos, feel free to reach out to me or comment on it. I'll follow all the videos. We'll be posting this one. This will be on YouTube, and then also share it on Instagram and Facebook. But if you have questions or comments, please write them, and we will get back and respond as much as possible as we get through the videos. On this side, you can see I'm closing that top leg off. My bottom arm is holding it in position, and I'm working on a nice exhale. I should have a pillow or something underneath my head on this one. Didn't have it available. So work on that flow. Good exhale. Open up in that windmill position. Really want to link your breath up to the stretch. Let that thoracic spine open up. Keep that hip in position. Almost there. Last one we're going to get into is downward dog. So as we get into this one, take your time on pedaling those calves out. We're working on the exhale, trying to bring our chest back towards our knees. Weight spread out in our fingers and hands. Every time I take an exhale, you'll see me get a little bit deeper into that stretch. Exhale, I'll bring the chest back towards the knees. I'm only holding for roughly 15 seconds. You can hold longer if needed. Enjoy the day.
Good job.
Nice job.